guess what? And the graduate college doesn't have that information. Are you going to graduate? You'll be a little delayed, but you have to have all of the paperwork done. And you know the old saying, the job is not done until the paperwork's done, right? Okay? All right. And now, the last thing that, again, Dr. Tim Marshall wanted also to let you all know is that the Hampton University, we do have an organization of graduate students. And there is a membership form online as well, and you can join that organization. This organization represents all graduate students. It promotes academic exchange between faculty, staff, and students. The OGS is also involved in professional development, graduate college recruitment, and the sponsorship of educational events which reflect the graduate student body. So if you are interested, please, there's an application online that you can apply for that. And one other Graduate Nursing Student Association is also something that I think you all have copies of this in your packet, and you all can review that. It is free membership. Okay, that is all that I have to talk about the graduate student organizations. The other thing that I want to talk about in this is professional organizations that you all can be a member of. One, and I'm a little biased on this one, I'm just going to say it. The American Academy, it's not the Academy anymore, the American Association of Nurse Practitioners. They do have a student rate. For regular members, it's $125. It's $55 for students. Some of the benefits of being a part of that is when you do take your certification exam and you decide to take the NCP, then there's a discount for being a member of that organization. ANA, there's a number of organizations that do represent nurse practitioners. They do have student rates as well. So if you're interested in that, there are some opportunities with that. This book is in the graduate office. This book has information, and I also will send that out via electronic and post it online. Information about the certification exam. When do you take it? Dr. Guyton Smith kind of told you all that the best time to take that is when? Right. As soon as we want you to be ready, but don't delay it, okay? So if you have any questions about how do I apply, it is all an online application. Okay, in addition to the American Academy of Nurse Practitioner Certification Program, there also is the ANCC is another certifying body this is for family. I'm pertaining to family nurse practitioners, where you can also apply for that as well. Okay, and join to be a member of the ANCC. And that's the American Nurses Credentialing Center. There is a handbook on what you need to do, what forms you need to submit. We do ask that when you are applying for certification, and Dr. Williamson has been through this a number of times, when you are applying for certification, let us know. There are documents that you need, and we have to sign off on those documents. Give us some time to do that, okay? So that it's not the yesterday thing. All right, any questions about certification? I do, for sake of time, I am going to, again, the other information that I had to show you regarding preparation, I will share that with you during your class times so that we can move along to the next thing. And the last thing is, Dr. Williamson, I think it's okay. Okay, yeah, and then we'll talk about the curriculum last. Okay.
Almost time to say good night. Okay, just briefly, I'm supposed to talk about the comprehensive exam. As you join the graduate curriculum with your classmates, you have the option of doing a Plan A and a Plan B. At one time, I had a lot of Plan A people. Thesis. I love it. But then Dr. Williamson likes comprehensive exams for her F&Ps. So since most, all of the master's students now are F&Ps, I am left alone. So now I have to beat up on the PhD students with this test. So one of these days I'm gonna get some more. So anyway, with the comprehensive exam, as Dr. Sanders Golson mentioned, you do have to fill out the application to take the exam. Now, that's one piece. You also have to register for Nursing 702. That gives you the platform for the exam, and it carries 1 credit. And we put that in because whether it was a 0 or 1, you had to pay for 1 credit. So we gave you credit for that dollar amount. So then the other piece that you fill out the form for the graduate college, that's the form that they send to me to put your grade on it. And it's an S or U. There's not an ABC. AB. That's what I need to start, right? AB. So it's an S or U. Okay. Now it's 702. This comprehensive exam is taken the last semester that you're in school. It's a 1-day exam. The morning you will have a question in which you'll have to do a written response. You are allowed to use laptops, and we'll go through that when the time comes. And once that 4-hour period is over, then I give you a breather, and then we start with the PowerPoint presentations. So what you have to do is develop a project on a current nursing issue, a population issue. So as being F&Ps, you know all about those kinds of things that you need to talk about that you're going to be working on as soon as you graduate. Now, the project is set up as a project because you're more in the practice area. However, your setup is based on the research process. So all those things that Dr. Gibson-Jones is talking about, put a pen in it, digest it, and keep your book handy so you can refresh yourself by the time the exam comes along. Okay, now, in terms of the topic that you're going to use for your presentation, I need that title sent back to me by October the 3rd. That gives me time to look at what you're planning to do to make sure not more than one student is focusing on that same issue in that same manner.
This only for those 3 students
Oh,
who
yeah.
are currently
Okay.
enrolled in 702, not for you all. Okay. Okay.
So that's for June. Akuna. Where's Keisha?
Over there.
Trying to hide. Okay, so that's by October the 3rd. And then I'll give you the go, and then you can start your lit review and putting your materials together. Now, in terms of research opportunities, most of those come about when you're working with faculty on a research project. Right now, most of our projects are in the form of grants. And probably everybody in here is a part of my pool for nurse traineeship. I got some papers for you to sign before you go to. Okay. Because I kept you all.
Okay, so you're gonna be in faculty class in these papers signed too. That's what we get cat.
No, I need them tonight.
That's what I'm saying. We got classes.
Okay. Now, if you are interested in working on a research project, let your faculty know so that when our faculty are writing grants and there is a component in there for a student in some position, then let us know so that you can get that experience. Okay, now in terms of training grants, traineeship, mainly for practitioners, all description practitioners, no nurse educators and no nurse administrators. Okay. Just breaks my heart that the administrators aren't in there. However, we do need F&Ps, and the thing that I want you to keep in mind is that the money that we're getting now is they want the students to be focused on diverse populations, underserved areas, rural areas. So somewhere along the line, when you're doing your preceptorships. I need some validation that you're working with underserved patients. Now, if you are out in Suffolk or Surrey, you will probably get some rural patients there. But I do need that underserved population because that helps to build our case for getting more money. Okay? Because if we're not using the money the way that they want us to use it, then it's going to be cut back. Okay, so the more you give me, the merrier. And I need the name of the preceptor, the name of the organization, and the address. Because what they do is put that information in the computer and we'll pull it up to say whether you're in an underserved area. So I kind of beat them to the punch because I started last year with that. And now it's mandatory for everybody. Okay, so you got your validation there. You got your validation there. Okay, the other area is the nurses faculty loan. That is for students who are interested in education, being nurse faculty, and also the PhD students. A lot of them are in that education cognate zone. So that's good money. It's a loan, but after working 4 years in an accredited school of nursing, you get 85% of your loan erased. That's the principal and the interest erased. The other 15% you pay back at a 3% interest rate. Now, where can you get a loan for 3%?
Nope, wish I had.
That is a good deal. It is a good deal. Okay, and I think that's all I had on my little paper. However, signatures. Now, Gabrielle, how do you pronounce your last name?
Kahar.
Kahar. Elliot. James. All's good. Akuna. I got papers for you to sign. Now, my other group, Romney, Stoves, Bullen, Ames, and Johnson. I have papers for you to sign, but I need some more documents too. The other thing I meant to tell you, for those 3 of you who are taking 702, this is the book that I issued to you, and it has step-by-step information that will help you set your budget. I don't know if I gave you this earlier or not. Okay, you can stop by anytime. You don't have to wait until, because we will have one day when a couple of hours that will go over some things to help refresh your memory about theory and research programs. So, and I gave you the book. And you will need your APA book as well. Okay, so while Dr. Davis is on her way up here, I will pass out my little papers.
And the other thing I want us to give Dr. Montgomery here, because you really, the grant that you set up and she's writing, you all, that's how you all are recipients, never mind, why you all are gifted with these books. We're not. That's a lot of hard work to write that federal dollars, and you do need to consider when that one of those semesters to go out. Surrey is a zoned area. Windsor, they're not that far from us. Look for preceptors out there. It increases your thinking ability, your critical thinking, because you don't have all that technology like we have here in the urban offices at your disposal. You've got to be able to think, you got to be careful of those people, those individuals, and those needs. And because of that grant, you don't have to buy these books, because you know how much books cost from undergraduate. Graduate is no cheaper. And that's why that was that opportunity. And we want to keep that going. So please do look at those. You might find somebody faster out in the rural area as well.
The other thing, you already know that we were funded for this 16-17 year. That's why I'm passing out these little forms. So it's good money. The books, and after I get the budget straightened out, you get a little stipend. So now, don't go out and splurge and buy a new purse, pair of shoes. Hold that and use it for some of those fees that come up. Because this will be a cash check.
EDMS.
Yeah, EDMS. Those things you have to pay for.
Yes. Castle Branch.
Insurance.
Yeah.
Elsevier.
For those of you that I said, I need some papers. It's a copy of your driver's license, your social security card, and your Hampton University ID. Melanie. I heard. Remove it. Sign with the students. Stories. Now, let me say one other thing. The amounts that you see on these, Romney. The amount of dollars that you see in this little paper, when I finish with these and get it all checked, it goes over to our
Grants management.
grants management guru. And she checks behind me to make sure that I'm not giving you too much money. Usually it doesn't come out that, I didn't give you enough. It might be that she says I've given you too much. But what I usually do is take your transcript, copy that, and send it with the form so she will see why I'm actually giving you what I give. But I say that because until she stamps the approval on that, then that's not a given amount. But very seldom do we have cases where it's cut back, because I figured. Okay, thank you very much. Okay. Or you can bring them and this side and Xerox them for me.
You have all your papers up, Montgomery?
I think you're almost finished.
Okay. Now we'll hear from Dr. Bertha Davis.
Okay, I had to get on the camera, so that's why she was saying that. And you see, she uses all those pictures up there with to tell people what she's doing without their permission. Okay, mine is quick. I had the grievance procedure. Every institution you go to, there is a grievance procedure. You understand that, right?
Yes, ma'am.
How many of you have used the grievance procedure in an institution? Good. How many needed to use the grievance procedure but didn't? Great. But just know that there is a grievance procedure, and you always start at the lowest denominator. And wherever, if you're in a class, it's with the instructor. Whether you like the instructor, whether you can't stand what the instructor is doing in the class, you have to go to the instructor and let her know that you're going to follow the grievance procedure. This grievance procedure is in your handbook. And when the handbook is completed, you will get a copy of the grievance procedure. Okay, if you need a copy before then, just let me know. Okay, Hampton University has a code of conduct. And what you think that is? How you shall behave, how you shall respond. What is your character like? And how are you going to represent Hampton University School of Nursing? And some people on the visiting teams when we've had site visits are amazed that Hampton University has a code of conduct as well as a grievance procedure, and the students know about it. Okay, because when we say the standard of excellence is, that's what we mean, and that builds character. That is a testimony to your character. Okay, and as well as when you look at the A&A code of conduct, professional ethics is a part of that. And that's the same thing that embodies the Hampton University Code of Conduct. Okay, again, that's going to be in the handbook. And right now it's Appendix E and G. I don't know what appendix is going to be once we get the handbook completed. But you need to know that there's such a thing. And if you are asked about it by any visitor or anybody from administration that walks in the hall, and you run into, if they ask you if you have a grievance procedure, the answer is
Yes.
and you know where to find it. In the handbook, and it's also in the college catalog. Okay, and it's the same thing, same for the university. It's just the individuals that you go to within your respective departments. Okay? All right, and I think that's about it for me. And if you have any other questions about it, or you want to know anything else about it, or you have problems with anything in the school that requires a grievance, then you let me know. And then find out where it is in the handbook, if the handbook is ready. And Dr. Gibson Jones will let us know when the handbook is complete. Okay, once Dr. Williamson gets to write her intro letter.
Oh, okay, I gave it to you for free.
Okay, and welcome, welcome. And those that I haven't seen, I think I've seen everybody at least. And we are glad you're here. You are our future. Okay?
Thank you.
And, you know, Dr. Saunders goes in. We have this HU Vets project. And that gives us money for veterans and supports your EVMS in a sense for your standardized patient. Okay? How many people have done that?
Not yet.
Oh, looking forward to it, right?
It was good.
Yeah, okay, it was good?
It was very good.
Okay, all right. So part of that funding comes from this HU Vet grant. Even though it's for undergraduates, when you're doing the standardized patient and those kind of practices, everybody gets an opportunity. Anytime you have a grant in the School of Nursing, it benefits the entire school. Okay.
Yes, it does. Thank you, Dr. Dan.
And this is resource faculty. I'm resource faculty, and this is the project director, right? Who told me I needed to say that.
Thank you, Dr. Davis.
I want to thank you all again for coming out. I know because we got class tonight too. However, I would like to go back and open the floor up. Is there anything that we have said or haven't said that you have a question about that we can answer for you right now?
And Dr. Williamson, if I may, Madam Presider, one thing I didn't talk about was the curriculum, and you see that it is on here. And just quickly, for those, we have 3 different cohorts in this room right now for master students, and this pertains to the master students. Those of you who have been in the F&P track, you know that we have had 619 in the summertime. It has been very, very challenging, needless to say, because getting preceptors during the summertime, we are in competition with others and people who are on, preceptors are on leave and so forth. So what we are trying to do some process improvement, and one of the things that hopefully will happen in the near future is that we will be moving 619 out of the summer. And so that it is a better opportunity for those of you who will be taking the 619 course. I know those of you who have already taken it and sweated through it, you know, you all hung in there, and we are very proud of you. But we have heard what you all have given us in terms of feedback, and we want to do something about it. So that's part of our process improvement, and we always continuous improvement, and we're looking to change that. It's not going to happen overnight. So those of you who are already in the program, some of you all may have it in the summer, and some of you all may not. But just to let you know, that is something that is in the works. And Dr. Williamson just opened up the floor. If there's any other issues, concerns that you all have, please let us know.
The other thing I'd like to add with the information regarding organizations, I would highly recommend for those who haven't, or for those who are coming in new, to join the nurse practitioner organization that are local here. If you live on this side, it's the peninsula. If you're on the norfolk side, it's it's the Tidewater. You can go to the VNA website and it can tell you the location and the individual. There is a student discount rate. It used to be like $25, $50. It might be up to $50 now. It is one of your best investments. One, you get to go to some free dinners and you get paid for by the reps. But when I used to get to go there, they were very nice. The other also is that's the best way to network. If you haven't figured out a future employer, preceptors, they're there. Their nurse practitioners are there. And they may be saying, my boss is looking for, or you can get to networking in and get you into a site. That is the best way for them to get to know you and bring you into the community. Take advantage of it. You don't have to go, but get on the roster so you can get a list of the different things. And when the local, when we have our regional conferences, it was in Williamsburg about a couple of years ago, then we went west someplace. But I want to tell you, take advantage of those opportunities now as you're starting out. It will help you to go a long way when you're needing resources. With that said, thank you. Question?
If you can't do the whole fee like right away, they have like an installment.
Oh, they have started an installment plan?
Yeah. If you can't do it, because if you do the ANA, they, you could do the option for the VNA too. And then they send a reminder emails for you every month. So if you can't do the whole fee, you could opt to do the
Okay, that's true. Okay, I didn't know they were doing it for students, but I know for regular members.
I think the regular members, I'm not sure about the students.
Do ANA,
I think it's
yeah.
like 55.
Yeah, oh, that's still a lot cheaper.
I think, I don't quote me.
No, because when I remember doing it when it started out as a student, they started with like $25. And they say $25, I know 10 years.
And the nurse practitioner, the advanced practice nurses, because that's what you all are becoming, or will be soon. Advanced practice nurses, I emphasize that because, you know, as I said, you start thinking like a provider because that's what you all will be, or are. So think like advanced practice nurses, and you're looking at some of those organizations that Dr. Williamson had mentioned, the VCNP, the Virginia Nurses, the Virginia Council of Nurse Practitioners. They all have nurse practitioner groups in there, and that's an excellent way to network, particularly the jobs. And as I said, also that kind of piggybacks on what I was talking about in joining those organizations, because they do also have their job banks. And you all also pay attention to the bulletin boards because I do post those out there, those job openings. And I'm actually getting phone calls from doctors that say, hey, I heard you all have some FNPs. Anybody interested? I got somebody out on maternity leave, or I need a nurse practitioner. And they do call us. Okay.
Well, thank you. 6:21, you can move to room 123, 514. Stay here. I'm gonna give you a 5-minute break.
Thank you again so much.
Thank you.
Anyone who needs to see me